So I begin and I pass the word to our friend María Isabel CABEZUDO de Rebaudi.
This is case studies involving the Rebaudi cards and proverbs in occupational therapy and speech therapy. For the last 5 years, we have been analyzing brain executive functions in the cognitive cards Rebaudi cards. Today, we will talk about the use of these cards in relation to diagnosis and evaluative phenomenon abstraction-concretion. For better understanding, the text is subdivided into 7 hypotheses, and multi-disciplinary external evaluations are presented to evaluate them in diagnosis, speech, and occupational therapy. Executive functions are complex mental activities and a set of cognitive abilities that govern behaviors and actions to achieve goals. Cognitive integrity is a variable that encompasses our knowledge in our surroundings, critical judgment, memory systems, decisions, social cognition, coherent thinking, and fluent language, said Dr. Vignati. The memory system is a receiving box for experiences and knowledge, with coding, storage, and retrieval processes. Memory throughout life suffers a natural slowdown, which may be normal or reflective of abnormalities. To determine this, there are evaluations, such as the diagnosis using proverbs. It is recommended to stimulate them, as it generates well-being and enriches the cognitive reserve. This inspired us to elaborate the RC with playful, paremiological, and neuroeducational criteria. They were called Rebaudi cards to differentiate them from the Wisconsin test, which is a test of cards and figures, but it does not contain proverbs and is not playful. Here we point out Broca's and Wernicke's area to illustrate the nexus between the brain, commands, behaviors, and speech. Cognitive linguistic and/or cognitive behavioral disorders go along with an inability to process and interpret information that is cognition. We analyze abstraction-concretion using tests and collaborative work with the RC cards. And there is a great relationship between communication and neurological and psychic functions. Knowing it is important because it is better to be safe than to be sorry. The game is a brain energizer. Helps with distraction, social integration, and exercise. It is a tool for the professional dynamics of occupational therapy and speech therapists. Hence the interest in validating the effectiveness of the RC game with different professionals in those fields. The paper explains how the confinement due to the pandemic in Argentina generates uncertainty, but also creativity, and inspired the adaptation of the game in the online field. For time reasons, it is omitted in this exhibition, but we emphasize that the RC game generates working memory triggers, stimulates cognition, mobilizes sensations, emotions, positive and planning behaviors, and planning abilities. Play encourages feelings of achievement and relaxation, influences attentional work, critical thinking, and verbal fluency. Emotions are tinged with the expectation for rewards and produce a natural phenomenon of endorphins and dopamine release, and the synapse is energized. It is all related to neurodynamics. When playing, meanings are negotiated and social emotional intelligence is energized. We are not only rational beings, but we are emotional beings who reason, given that brain functions masterfully integrate reasoning with emotions. The RC game, in addition to other functions, allows you to work on abstract thinking and fluency. The understanding of abstract thinking serves to test in some cases and exercise in others. The ability to understand and express concepts from logical reasoning, a noticeable phenomenon in neuro-cognitive evaluations. Metaphor is a word or phrase used to describe someone or something in a way that is different from its normal use, to show that the two things have the same qualities and make the description more powerful. That is why they're used in tests. Pearls of Dew or the neural butterflies of the soul mention concrete words with an abstract idea. In the proverb time is money, there's an abstract concept that refers to value to be cared for, and it's not a simple discursive section, but a conceptual tool that highlights some of the features while hiding others, inciting an interpretive game. In sum, it is a thought process that leads first to understand and then to compare phraseological units with a certain idea to open up two consecutive mental actions, interpretive play and explanation. The capacity for abstraction that is demonstrated carries other variables of the dynamic of executive functions, validity and language. Language is not only a privilege for man. Language is also his prison, as Barthes said. Since in the critical process of interpreting, we place a good part of ourselves. Foucault said, in other words, there is an ideological phenomenon. They represent ideas which, in a cognitive behavioral exploration, reveal indicators. The interpretation and reformulation of ideas with other words and personal language are used to achieve this. The limits of my language mean the limits of the limits of my language mean the limits of my world, said Ludwig Wittgenstein. When looking for neuro-cognitive parameters, the patient is proposed to interpret a proverb and explain it. To better understand abstraction-concretion, there are three key questions. What do you seek to evaluate? How is this phenomenon explained? And what is abstraction? The action of abstracting forces us to understand the metaphor by separating a concept and critically analyzing its essence or notion. Here, the possibility of critically explaining or not demonstrate the executive functions, mental flexibility, and other variables. Given that there is no unitary executive function, but rather processes that converge in the general concept of an executive function, planning, behavioral control, mental flexibility, working memory, fluency, and attention can be reflected at some point in the game, in the proverbial interpretation and the abstract concrete phenomenon of a diagnosis. This requires taking into account the level of language and other data of the patient that guide them to select the appropriate saying to be evaluated. The first hypothesis sustains, avoiding the risk of two different levels of similar and confusing effects mixing in the neurocognitive evaluations. A, being personal or emotional limitations to express themselves due to fear or ignorance, and B, being certain anomalies or frontal dysfunctions which would cause problems to handle brain information and or to express it. The prefrontal cortex involves attention, thought, and behaviors, being a bridge between perceptual, emotional, and motor control centers located in other parts of the brain. It is the ability of the medical professional to test it and examine the executive system of attention. Consequently, it is vital that the assessment tool shows specificity as a marker of frontal dysfunctions to clarify existing anatomical and functional correspondences. Having defended the second hypothesis leads us to sustain, regarding executive functions, the not advisability of using extensive tests, since they conspire against the attentional effort and make the assessment difficult or inaccurate. The game's briefness and playfulness makes the evaluation less frustrating and favors feedback and prevents the loss of focus or the emotions to be confused with disorders. It is important to appraise a patient's previous data to proceed to choose the adapted cards according to the characteristics and the medical criteria. This data includes level of language, schooling, profession, number of languages, culture, interests, codes. They are orientational for the evaluation process. Given the RC's versatility, the game and the personal experience of the author are made available for the evaluator if needed. The third hypothesis considers the interdisciplinary role that is offered as support for the work. It refers to a cognitive, linguistic, neuroeducational, and paremiological aspect, which the medical professional does not need to master. The vector is oriented towards abstraction-concretion and the executive functions, and the proposed role is collaboratory, multidisciplinary for those who work in this field. Now, promoting reliable results also depends on refining processes and avoiding dichotomies. The use of repeated sayings in printed evaluation forms and tests is not convenient. It is necessary to have great flexibility and versatility, selecting proverbial examples suitable for each patient in number, theme, and level of difficulty. This would be the fourth hypothesis, recognizing that it is not a trivial task to choose proverbs or their proper application. Proverbs deserve to be functional to testing the instruments used with cards, patient's data, and instructions and medical goals. The fifth hypothesis affirms that the briefness and empathy and feedback of the RC expedites the return of the ability or inability to solve the metaphorical interpretation and the appearance of markers of frontal dysfunction. But it is emphasized that what is proposed with the RC game is designed to achieve it without masking any theology nor influencing responses. The opposite would be called concreteness. That is, the patient cannot do it due to various disorders, which we will not analyze today. We warn that the older the age and lower the level of education, the number of correct categories of the evaluated decrease, and they might commit more errors. Although this constant does not reflect anomalies per se. That is why we talk about prevention at the beginning of the paper and exercising the executive functions throughout life. The sixth hypothesis is the usefulness of analyzing the patient's singularities prior to a test in a general way. Also, neuroeducational and paremiological data previously obtained by those of us who work in these disciplines help. The seventh and last hypothesis mentioned the contribution of adaptive RC cards and show the value of disciplines such as paremiology, literature, neuroeducation, and criteria related to professions, such as occupational therapy, speech therapy, and psychology. Now, this is the time for empirical data. This is knowledge of psychologist Ileana Coppola, specialized in neurology, and occupational therapist Silvia Zambale, specialized in testing. The empirical data was collected from 3 different age groups. And now we include a couple of proverbs. Speak so that I may see you. And we are the masters of the unsaid words, but slaves of those who we let slip out. As for the cases, first we have cases of adolescent patients. Most do not know proverbs, which make it difficult to know if they are actually suffering from cognitive problems to interpret them, or if they reflect any ignorance. They show disinterest in proverbs and therefore disinterest in ignorance conspire against clear assessment. We recommend difficulty 1 level cards with youth themes such as sports, rock music, and online expressions. Number 2 are cases of poorly educated adults. They remember proverbs from the popular imagination, but they cannot explain them since it represents an effort that their level of language does not allow them to overcome. We recommend difficulty level 2 cards and personalized. Now, for group number 3, these are patients with good education or higher education. They have the ability to respond automatically to the request since the proverbs are highly familiar. It drives a mechanical response that invalidates the item in question. So we recommend difficulty level 4 or 5. Now, figure 3 shows percentages of intervening groups. Most of the beneficiaries need access to different levels of difficulty that the game includes and cards adapted to previously obtained data. There is a mixed response to the proverbs included in forms, but the impact after working with the RC parameters is good. This table marks percentages and changes made when agreeing to use the RC cards, which demonstrates the usefulness of using proverbs with different levels of difficulty. Now, considering the previous cases where the patient must infer the proverb represents other words and they must translate into his own, which the evaluator tests, the variables are augmented. Consistent social cognition, coherent thinking, and language fluency with others in relation with the research and hypothesis. Also, the solidity of the RC is reflected in exercise, rehabilitation, and diagnosis. In relation to the consideration of versatility, paremias, colors, numbers, images, and levels of difficulty, such a conjunction turns out to be an added value to the game. In short, the phraseological bulwark enriches itself at the same time and prevents proverb from devaluing a scientific role due to random or arbitrary repetition. Regarding abstract concretion, there are authors who emphasize economies reflected in tests, but it follows that the precautionary actions taken and the vector shows based on the assumptions demonstrated in this work would operate as a catalyst for weaknesses. Now we will talk about external evaluations 1 and 2 that allow obtaining objective views on what has been said and done. Professional concepts about the RC game and textual documentation of opinions for length reasons are in the book that comes with the game. What do the cards with proverbs and playful cognitive game evaluate? Abstract reasoning, problem solving, and flexibility. It allows changing cognitive strategies or proverbs according to specific needs. The measurements of singularities of the executive functions shows a certain specificity as a marker of frontal dysfunction. The answers. Accuracy is observed in responses and avoid relentless and correct responses. What advantages are inferred? Well, empathic work empowerment due to briefness and playful format. It is less frustrating than other options. Surveys show that it speeds up responses due to playful climate, but also extends the fields of observation. Versatile options with different difficulty levels, images, colors, numbers, and proverbs, which allow to predict changes in situ. Simple application, clinical sensitivity, variety of operations, support or the evaluator in the collection of the patient data, and some other observations. Quick data collection of the validity and abstraction, possibility of psychometric evaluation in ascending and or descending line matching the numbers versus images. There are also innovative possibilities of working with colors, figures, and proverbs. Cognitive cards adapted to specific requirements and situations. Multidisciplinary interaction with the author upon request or clarification of doubts. Great. All right, now we will go on to external evaluation number 2, which is an interview with speech therapist Licenciada Calabrini, no, we do not have any slides, which is a speech therapist and a neurologist from a hospital here in Buenos Aires. When asked, what do you think of the cognitive Rebaudi cards? She answered, they are cards that can be part of the rehabilitation treatment of aphasic patients, since they stimulate executive functions based on the game. They offer space for interaction between patients and therapists, allowing for the strengthening of therapeutic links, and they greatly help the treatment. They acquire fundamental value when it is taken into account that they can be adapted to the personal and social needs of each patient. They help imagination. They offer a universe of possibilities because they have so many functions. Finally, I observe that they are also constitute a versatile way of enhancing creativity in conflict resolution, closely linked to the intelligence and emotions. To conclude, the game and its application have gone into question. Various professional testimonies have been obtained that consider it a useful alternative, and whose advantages are highlighted in the preceding analysis, as well as professional opinions. Proverbs are empowered in their versatile role in RC cards with different uses and adaptations to the social framework, interest, education, language level, and needs of the patients. Dr. Meader said as follows: Proverbs have been utilized extensively as a diagnostic tool across a variety of disciplines, including psychiatry, neurology, psychology, and speech-language pathology. Proverbs are familiar, fixed, sentential expressions that convey well-known truths, social norms, and moral value. Before closing, the gratitude for opinions and guidance for different qualified professionals is highlighted, giving credit to the theoretical and applied research.
Thank you, Dr. Meader. Thank you very much.
See. All right. The RC game was introduced in 2015 as a proverb game to exercise memory and executive functions. Its playful design and neuro-educational criteria allowed adaptations and increasingly ambitious and specific options, such as stimulation, testing, and rehabilitation. Working with complex functions require optimizations of such criteria. That is what collected with explanatory information in a query line are collected in a book that accompanies the game. The vast universe of the brain and its functions, the only organ that can think in itself, is a compelling theme, but it is not exhausted by isolated experiences and induces continuous self-evaluations because what is not evaluated devalues. Furthermore, such investigative complexity requires a clear starting point, but not close goals or unambiguous proposals. It observes follow-up and monitoring, values and principles of epistemology, rigor, and optimization that favors the passage of time. This is reminded of a Spanish expression that exalts perseverance, so dear to the researcher. Where there is a will, there is a way. Finally, at the end of this article, we return to another proverbial expression previously mentioned, and of robust symbolism, which is attributed to the philosopher Ludwig Wittgenstein. The limits of my language mean the limits of my world, for my world. This would be the essence of our work.
It's okay. Thank you very much.
Thank you very much, Maribel, María Isabel Cabezudo de Rebaudi, que nos ha presentado una buena ponencia. Thank you very much for your presentation. And this is the continuation of other works that we have presented at our colloquia at Vira in previous years. So it's a very nice and multidisciplinary work that you have done using your cards and all the research with other colleagues from doctors, from medicine, therapeutics, and so on and so on.